Hello, my name is Andrea and I am the lead nurse clinical educator for Southern California, and I want to talk to you today about how to prep and administer Pfizer. For Pfizer, this is an mRNA vaccine. This vaccine should be milky in color. This is a 2-dose series separated by 21 days apart, and each dose should be 0.3 mLs. This vaccine is also diluted with 1.8 mLs of sodium chloride, and we want to give this vaccine IM. Okay, let's talk about how we would locate the expiration date and the lot number for this vaccine. For Pfizer, the expiration date and lot number is located in the black box on the vial. For instance, my vial says 07/20/21. If I were to document the expiration date in the drive-through system, I would use the last day of the month. So it would be July 31st, 2021. Right above the expiration date is your lot number. Let's talk about frozen vials prior to use. Pfizer is stored in ultra-low temperatures between -80 to -60 degrees Celsius. During storage, we want to make sure that we are protecting our vaccine from any type of light at all times. Let's talk about thawing your vials. When I say thaw your vials, I simply mean taking them out of the freezer, placing them into the refrigerator between 2 and 8 degrees Celsius so they can come from a solid to a liquid state. Unpunctured vials of Pfizer can stay stored in the refrigerator for 1 month. If you have a container that consisted of 25 vials, you would have to take this container out of the freezer, place it into the refrigerator between 2 and 8 degrees Celsius for 2 hours so it can thaw. If you had the bigger container that consisted 195 vials, you would then take that out of the freezer, place it into the refrigerator, and let it sit there for 3 hours. Okay, let's talk about thawing our vials for immediate use. Say that we don't have 2 to 3 hours for our vaccine to sit in the refrigerator. Say we have a line of people or we have a bunch of appointments bright and early in the morning. You show up to work and your vaccine is still frozen. What do you do? At that point, you would take your vaccine and you would let it sit at room temperature for 30 minutes. The room temperature can be up to 25 degrees Celsius. When you're letting that vaccine sit at room temperature, make sure that we are protecting it from any type of light. Prior to prepping or administering Pfizer, you do have to allow that vaccine to come to room temperature. So you would take the vaccine out of the refrigerator. It's in a liquid state. You would then let it sit at room temperature for 15 minutes before we can prep it, administer it, or dilute it. Okay, let's talk about undiluted versus diluted Pfizer at room temperature. If you have your Pfizer vial out at room temperature, it can only sit there for 2 hours without it expiring. So we want to make sure that we are diluting our vials within the 2 hours. Once we dilute this vial with the 0.9% sodium chloride, you will then extend the life of the vaccine to 6 hours. Remember, we are diluting with 1.8 mLs of 0.9% sodium chloride. Once you dilute your vials, you will then get 6 doses. Let's talk about a couple key points. When you are diluting your Pfizer with that 1.8 mLs of sodium chloride, please make sure that you are using exactly the 1.8 mLs. Do not use more or do not use less. If you use more or less, potentially you are over or under vaccinating your patients. Once you dilute correctly, you should end up with 6 doses. Occasionally, you will get 5 doses. If that happens, what we would like you to do is take your vial, and then go ahead and write a number 5 on the bottom of it. How to prep Pfizer. When prepping Pfizer, you're going to need 2 needles and 2 syringes. One of them is going to be so you can dilute your vaccine with that 1.8 mLs of sodium chloride, and the other one is going to be to draw up that 0.3 mLs and vaccinate your patient. When you pull your vaccine out of the refrigerator, what you want to do first is you're going to check your expiration date, make sure that your vaccine is not expired. After you check your expiration date, you will then check the color of the vaccine, make sure that it is milky and that there are no particulates floating in it. If you pulled your vaccine out of the refrigerator and it was in a liquid state, you would then let it sit at room temperature for 15 minutes. Make sure that you are covering it and protecting it from any type of light. If you went into the refrigerator and your vaccine was frozen or partially frozen, then you would let it sit at room temperature for 30 minutes, protect it from any type of light. After that 15 or 30 minutes have passed, you will then take your vial and you're going to have to gently invert this vial. So this would be 1, 2, 3, and you're going to have to do that 10 times. Make sure that you're not shaking this vial at all. If you shake this vial, it is no longer valid. So after we inverted our vial 10 times, we checked the expiration date, we checked the consistency, we're going to go ahead and clean both of our stoppers at the same time with an alcohol wipe. We're going to allow them to air dry. The sodium chloride or the Pfizer itself have no preservatives, so we never want to introduce any alcohol into either one. The dilutant is 1.8 mLs, so we're going to draw back 1.8 mLs of air into our syringe. Make sure that we have the right amount. While the vial is stabilized on the table, we're going to go ahead and introduce that air above the sodium chloride because we don't want to disturb it. So go ahead and put your air in. Then we're going to gently invert and pull back 1.8 mLs of sodium chloride. Stabilize the vial back on the table and take the needle out. Then you would take your Pfizer vial. Remember, we've already cleaned this vial, and we're going to put the needle in above the medication, and we're going to slowly put in that 1.8 mLs to dilute the vial. Now that we're diluting this vial is now good for 6 hours, and we have extended the life. Before you remove the needle from the vial, what you're going to do is you're going to make sure that you're not in any of the liquid itself. You're going to bring it up into the needle into the air pocket space at the top, and you're going to equalize the pressure of this vial. So we put in 1.8 mLs of sodium chloride, so we're going to pull back 1.8 mLs of just air. So we took our air out, going to take our needle out, and then we're going to activate the safety, put that in the sharps container. This is after dilution. So now this vial is good for 6 hours. We would then get our Sharpie and we're going to write the time and date on this vial. After we put the time and date on the vial, once again, we have to gently invert 10 times. So that's 1, 2, until we get to 10. After we invert it, we're going to go ahead and clean the top again because we touched it. Allow it to air dry. We're going to draw up our dose. Our dose is 0.3 mLs, so we're going to draw back 0.3 of air. While our vaccine is stabilized on the table, we're going to go ahead and introduce the air above the medication. Then we would gently invert and draw back our 0.3 mLs, our dose. Put the vial back on the table and take our needle out. You are the prep nurse. You will have to recap this needle. Just make sure that it is clean and you're not touching any surfaces with it. So go ahead and use the one-handed scoop method to recap. Make sure that you do hear the click and you give it a little twist just to make sure that the needle is properly on the syringe. This would be considered your first dose. You want to make sure that it is in fact 0.3 mLs. You want to make sure that it is milky and there's no particulates floating in it. You will then pass this off to the administering nurse. You should have 5 doses left in your vial. And remember, we have to use those within 6 hours. In between each dose, we do have to invert the 10 times. So, for administering Pfizer, when you are the administering nurse, it is your job to make sure that you do have the correct dose. So you will go ahead and check your dose, make sure that you do in fact have 0.3 mLs. You're going to make sure that your vaccine is milky in color, and you're going to make sure that there are no particulates floating in it. If any of those occurred, of course, we would return this syringe back to the prep station. After you have identified your dose, you went over all of the screening questions with your patients, and you know that your patient has given consent, you will then continue to vaccinate your patient. When vaccinating your patient, what you're going to do is you're going to have them drop their arm, and you're going to find the acromion process, which is the bony prominence on the lateral side of the arm. Once you identify that, you're going to go 2 to 3 finger breaths, just depending on how big your fingers are below that, and then find your landmark, and that would be your deltoid muscle. So this would be my injection site. So once you identified your injection site, you have your patient here, you're going to get your needle. We're going to use a 90-degree dart method. When you are vaccinating, go ahead and use your best nursing judgment as far as what technique you're going to use. So if it was a pinch, or if you were going to spread the skin or use the Z-track method, we just want to make sure that we are going IM and not sub-Q. If you go sub-Q versus IM, a week later, your patients will have a huge welt on their arm. So, dart method, never vaccinate like this. Don't get in the habit of doing this because you're going to lose some of your vaccine before you even go in, or you could possibly put it sub-Q. So you'll go ahead and we're going to cleanse the skin and make sure that we do that in an inner to outer circular motion, and we're going to allow it to air dry. Once it has air dried, we're going to go ahead and get our vaccine. We're going to remove the cap, and we're going to go in at a 90-degree dart method. So 1, 2, 3. We'll go ahead and push the vaccine. Once it's completely in, hold for 2 seconds. 1, 2. Pull out at a 90-degree angle. And this is your first priority after vaccinating your patient, is to activate the safety lock on a hard surface, okay? Activate your safety lock, put it in the sharps container. We never use our fingers to activate any of the safeties because that can potentially end up being a needle stick injury. So go ahead, activate on a hard surface, drop it into the sharps container. If your patient is bleeding, you will then go ahead and apply pressure until that they were done bleeding. After that, you would go ahead and apply a Band-Aid. After your patient has been vaccinated and you have answered their questions, you're going to go ahead and provide them with a vaccination record card, also a EUA fact sheet, and then you're going to have them go to the observation waiting area for 15 or 30 minutes, just depending on how they answered those screening questions.